For hidradenitis suppurativa or HS, we often do use biologic medications depending on the course of disease a patient is presenting with. Understanding where a patient is might dictate how aggressive we are to control that inflammatory response that they have. There are various scoring tools that different doctors will use to decide how much involvement of our skin is there, how many nodules, for example, a patient might present with, the locations they have disease, how recurrent these processes are, how many bandage changes patients have to go through. This gives us a sense of how severe the disease is for individual patients. So think of biologics in that category of being used for patients that usually have furthermore progressed disease. They have more inflammation associated with their lesions, and perhaps the interventions that are superficial, such as topical antibiotics and anti-inflammatories, just aren't cutting it. Steroid injections and other things to treat individual lesions is simply not enough. Those are the patients we start to say we need to take it a step further, especially if their pain is not well controlled. Biologics may not be right for everyone. There are some patients that might have had a history of other types of diseases, say tuberculosis or hepatitis, that might preclude them from going on a biologic right away. But these are things that we can consider over time based on addressing different concerns they might have. I have a lot of patients that say they want to consider biologics, but they just don't like the idea of a needle or an injectable. And I understand that. That's really uncomfortable, especially when they're self-administered. When we do prescribe these medications, they often do have a training process that often the medication will provide, or oftentimes your doctor can help you through that initial injection as well. Most do come in a pen form, which can be very easy to administer. It's a clickable pen that gets the medication administered within seconds, and they only go superficially into the skin. We're not going into the muscle like when you get a vaccination, for example. Those are very different. They go much deeper and can have a lot more discomfort. If you're curious about biologics and if you would be a good candidate based on where you're at with the symptoms that you're experiencing, talk to your dermatologist, because ultimately we're the ones that prescribe these primarily for HS. We can go through this with you and talk through some of your concerns, whether it's being a little nervous about a needle or an injection, what this might mean. That's what we're best suited to do because we do this routinely. So knowing that you can talk to your doctor about every step of the way is really important.